Dr. Joe.
Let's talk about the sacroiliac joint then specifically. Now your sacroiliac joint sits between the tailbone, which is this portion here, and the ilia, which is this portion of the pelvic bone itself. And the joint itself, as you can see, there's two of them, and you find that they pivot, they either move together or in opposite movements then as such. And what's quite interesting is that usually in the time of a sacroiliac syndrome, what often happens is that the one side locks up while the other side becomes what we call hypermobile. And very often the side that the person feels it is not the problem. The problem is very often on the opposite side. So you'll find that, let's say a person comes in with pain on the right hand side over here, very often it's the left sacroiliac joint that is locked up and not quite moving like it should. So what happens then from there is that the muscles start getting overworked. And if we look at the muscles then specifically that play a role with this, we're looking at quite a few muscles that then play a balancing act around that sacroiliac joint. So we're looking at the glute maximus, which plays a minor role, and more specifically the glute medius. Glute medius, obviously, big muscle when it comes to hip joint movement, but also plays a big role in stabilizing that sacroiliac joint. Now, very often when a person's got SI syndrome, the muscle is actually inhibited. In other words, that glute muscle is not quite firing off and working like it should, also then adding into pain. Now, usually what happens is that the hamstrings also play a role in it at the same time. So the hamstrings actually attach down through the bottom here, and very often when it's got a sacroiliac syndrome, the hamstrings will then be inhibited as well. In other words, they'll seem weak when we test them. Other muscles that play a role then is your lats, and then also your obliques. So very often people forget about the oblique muscles or stomach muscles. And as we go deeper, we can then see that we also have your rectus spinae, and then also more importantly your quadratus lumborum muscle. So these muscles typically then play a role trying to stabilize that sacroiliac joint. It's also what's quite interesting about this joint, the only joint in the body that doesn't have muscles crossing over the joint that would provide stability. So that's why we get that indirect stability from all these different muscle groups. Now if we look at the quadratus lumborum muscle, usually when it's involved, it can cause quite a lot of lower back pain. So you can have a person coming in with lower back pain actually coming from that sacroiliac joint. And also then we can have a person with referred pain down the leg, which could be coming from the glute medius muscle, could also be coming from the piriformis muscle, or even the hamstrings themselves. Now the joint capsule, when it's inflamed, let's get back into the joint capsule itself. So with the joint capsule itself, you'll see that the joint capsule is then around the joint like this, and it consists of quite thick ligaments, and sometimes this can literally pinch. So in other words, person gets up, it feels like a sharp knife stab into that sacroiliac joint and can be very painful. And you can see that there's quite a few of these ligaments that sit then deep within that joint. Now if I then remove the actual bone itself, you can see that the joint runs in through this area here, and that's where the contact then gets made between that and the sacrum from there. So that's what we're looking at then with specifically the sacroiliac joint. Now when it comes to the pain patterns and things of the sacroiliac joint, is we find that the sacroiliac joint itself can cause pain locally, can cause pain referred into the lower back, can also cause pain down the legs. You can then have the referral patterns then for the muscles themselves. And the muscle systems, you can have pain patterns from the glutes, the lats, the QL, the abdominals. All of these cause lower back pain and referred pain again down the leg. And also we get that muscle inhibition I was talking about earlier. So weakness through specifically the glutes and the hamstrings. Very often your hip flexors are fine. Okay. Now, according to some of the research out there, your sacroiliac joint dysfunction is quite common, between 15 to 30% of people, but very often more common, specifically in women who are going through things like perimenopause, where you've got changes in the hormones and the ligaments into the body as well. Now, people often underestimate how painful this can be. The pain levels of the sacroiliitis can be a lot more severe than what people expect. So you can have an 8 to even a 10 out of 10 pain with this. It can be quite debilitating pain-wise. However, the beauty of the condition is that with treatment we can get on top of it pretty quickly. Generally, once the inflammation is down, the inflammation process with treatment can take anything from 2 to about 6 weeks. Once that's gone through, about 6 to 8 weeks, we can get the area nicely strengthened and stabilized. And then it's just a matter of looking at maintenance long term from there.